A 5 on your health tonight, teaching your kids what to do in an emergency. Police in Needham say it starts with calling 911.
In a Facebook post, officers credit 2 kids, ages 9 and 11, with getting help right away for a man who was choking. They calmly told the dispatcher what they needed and where to go.
Joining us now, Dr. Ali Raja, Chief of Emergency Medicine at Mass General Brigham. Dr. Raja, thanks for being here. Can only imagine the stress of this situation, and these can be scary situations, life and death. Are you surprised these kids were able to apparently stay so calm?
You know, honestly, not as surprised as you might think. Kids are so capable when we give them the tools as well as the permission to act. And it's interesting, in the ER, the first thing we do when a critically ill patient comes in is call for backup, even while we're still stabilizing them. And when we teach people CPR, we always say to call for help first, because even the most trained person might still need backup. And those kids just understood that instinctively. It was awesome.
Yeah, absolutely. Now, your kids are a little older. What have you taught them about calling 911?
Jessica, that's a great question. So we started early and we made it feel normal, the same way you might talk about a fire drill. I want to reassure patients, kids will not get into trouble for calling 911 in good faith, since it's always better to call and be wrong than to hesitate. Now, while you shouldn't actually dial to practice, you should role play it. Pretend you're the dispatcher, have your kid tell you their name, their address, what's going on, and that address piece is so important. Your child has to know their home address cold, not just assume that someone will find them.
Yeah, what age makes sense to be kind of hammering these things home? And are there other skills that you think kids can learn to help save a life?
You know, the most important thing in terms of doing this is just getting started. At the elementary age, it's absolutely right. These kids were 9 and 11. That makes sense. But it's important to teach them what an emergency actually looks like. Someone who's unresponsive or not breathing or has their face down in the water or is bleeding a lot, those signals mean that they should act now. And kids can really do things. They can do the Heimlich maneuver. They can apply firm pressure to a wound. And hands-on CPR, hands-only CPR, is something that the American Heart Association says we should actively be teaching school-aged children. The most important thing is what these kids already knew. When something goes wrong, don't freeze. Go get help.
Absolutely, Dr. Raja. We always appreciate you. Thank you so much.